The past 3 weeks have set consecutive records for the number of new coronavirus infections in Florida, stirring fears that the tsunami of cases that the state had previously avoided has finally arrived. Governor Ron DeSantis has said the spike can be explained by the recent increase in testing, especially among younger adults and high-risk populations. But a number of cases tied to bars and restaurants has led to questions about whether Floridians have let their guard down and whether the state's reopening is partially responsible for the increase. On Friday, after the state recorded 25,000 infections in 5 days, it announced it had suspended the consumption of alcohol at bars. How worried should you be? The Tampa Bay Times examined the data tracking coronavirus spread and asked 8 public health experts. The analysis revealed key differences between infections being discovered now and those from a few months ago, including some positive changes that DeSantis has touted in press conferences. Even as cases have gone up, deaths so far have barely budged, increasing from an average of 35 deaths per day earlier this month to 38 per day in the past week. There are other signals in the data that experts find alarming, indicators that they said leave little doubt that Florida's outbreak is now growing extremely quickly. Here's what we found. The spike in cases far exceeds the increase in testing. Since June 1st, the average number of tests per day has increased by less than 25%. During that same time, the average number of infections per day has nearly quadrupled, from fewer than 1,000 cases per day at the start of this month to more than 4,000 cases every day in the past week. On Wednesday and Thursday, Florida added more than 5,000 cases. On Friday, the state added nearly 9,000 cases, approaching some of the peak days in New York, the state with the worst outbreak. We're finding more cases because there's more testing, that's true, said Mary Jo Trepka, a professor of epidemiology at Florida International University. But that's not the only explanation, because we're also seeing that the portion of positive tests is increasing. Over the prior month, fewer than 5% of test results returned positive, on average. As of June 17, that number jumped to more than 10%. DeSantis has been slow to link the higher positive test rates to increased community transmission. Until this week, DeSantis has said that increased contact tracing explains the uptick. A driver talks to an employee of MedExpress Urgent Care at a testing site in Clearwater. Cars, some packed with up to 5 people, waited close to 7 hours for a COVID-19 test. URSO Times. In a June 16 press conference, DeSantis pointed to the state's efforts to trace contacts among farmworkers and migrant workers, among whom the percentage of positive tests can be upward of 40%.